These are a series of exercises which can help with hip and knee pain, or if you're suffering with stiffness or a feeling of weakness or lack of mobility in the legs. None of them should be painful to do, so if they're painful, just stop them. Aim for 10 repetitions of each of them if you can do, at least once a day, but you can do them up to 3 times daily. And if your balance is challenged or you're just not comfortable with any of the balance ones, just do the seated and lying exercises. And as ever, if you're having any trouble, if your symptoms are getting any worse or not improving, then see your physio or GP. So sitting comfortably, straighten your leg out as much as you can, and then bend the knee back in as far as you can do. A dining room chair is perfect for it because that lets you bend your knee back further under it. It shouldn't be uncomfortable, just take it as far as you can uncomfortably go, just hold it a second or two and then back in. Sitting comfortably with your feet flat on the floor, lifting your heel up off the floor and back down. Your knee should be comfortably bent, roughly 90 degrees is ideal. And then just holding a couple of seconds. The last one, from a seated position, feet roughly shoulder width apart, cross your arms over your chest, and then just trying to stand up, but make sure you can maintain your balance. And then back down. And some exercises in standing. Behind a sturdy chair or at your kitchen worktop's perfect, that we can lean onto as much as you need to for balance, or you can just hover over with your fingertips, whatever you feel comfortable with. If you're not comfortable with your balance doing the standing exercises, just do the seated and lying ones because safety is paramount. So first exercise from standing, feet roughly shoulder width apart, and on both sides, just coming up onto your tiptoes, hold a couple of seconds, and then back down. The next exercise from standing, again, feet roughly shoulder width apart, and then from there, just bending the knees gently, and then back up. When you're coming down, you want to make sure you can still see your toes, that way you're not putting too much pressure onto your knees. Just holding it a second or so at the bottom, just to make sure you're still in control of it. Another one from standing, feet roughly shoulder width apart again, keeping your body upright so you're not leaning forward, and then trying to keep your leg as straight as you can do, and then just taking it out to the back. And you want to do it on both legs, not just the affected leg. If you're comfortable trying with your balance, you can again stand next to a sturdy chair or your kitchen worktop and try standing in one leg. So lean onto the worktop as much as you need to, making sure your bottom's not sticking out. Try and keep as upright as you can do. Lean your body weight over to one side and then lifting the leg up. It doesn't matter if you're not staying absolutely steady. The aim isn't to keep absolutely perfectly steady, it is just to try to maintain the balance somewhat. But if you're not comfortable with it at all, feel like you're going to topple over, then just don't bother. Again, standing next to a surface that you're happy is nice and steady, like a chair or worktop, swing one leg smoothly out to the side and back in. You don't need to hold it at all, just a smooth swinging action. And then you want to repeat also on the other side. From a lying position, either the bed or the floor, wherever you're more comfortable, you're trying to bend your knee up, keeping it in a straight line with your hip. So just take it up as far as you're uncomfortable. It'll be much easier if you do it without shoes on, and keep socks on, that way it'll be comfortable and your sock can slide on the surface. So it should be a slow, smooth movement. Take the knee up as much as you're comfortable, make sure it's not rocking out to the side, and you're aiming to get it up as close towards your bottom as possible. You can make this exercise easier by popping a plastic bag under your heel, that way you get less friction and it'll slide easier. Lying on your back, if you bend the unaffected knee as much as you're comfortable, just have your foot flat on the bed or the floor, then from there you're trying to keep your knees straight as you can do and lift off the bed or the floor. Hold it a few seconds and then nice and smoothly back down. You want to make sure it's not falling back down, it should be a nice smooth action as it eases back. So if you get a rolled up towel and pop it behind your knee and then rest your knee back onto the towel, then from there you're just trying to straighten your leg as much as you can, keeping the back of your knee on the towel so that your heel lifts off the ground or the bed. You're just holding it a second or two and smoothly back down. You can also do this exercise without the towel, so you're just lying flat on your back and then trying to straighten the back of your knee back into the bed as much as you can do. You should just feel the muscle on the outside just above your knee tensing. If you're not sure if you're doing it properly, just pop your hand onto this muscle in this region on the outside of the knee, and then you'll feel if it's tensing when you're doing it.